Glioblastoma is one of the deadliest forms of cancer. It's the brain cancer that claimed the life of Senator John McCain. Researchers at Mayo Clinic, Arizona are working on a new way to fight the disease. And joining us now is Dr. Sujay Vora. He's a radiologist at Mayo Clinic, Arizona. Good to have you here. Thanks for joining us.
Hey, thank you for having me.
Quickly, definition. What is glioblastoma?
So glioblastoma is actually a primary cancer of the central nervous system that actually originates in the brain tissue itself, as compared to other cancers that spread to the brain. That's called metastatic disease.
It sounds like it's particularly aggressive, is it?
It is. You know, we're really humbled by how glioblastoma really affects the American population. The average survival in most patients are well under 2 years, and particularly for older patients, it's well under 9 months.
Is it because it tends to be found late or because it is so aggressive?
It's a combination. Most patients don't present until patients are actually having problems. So whether or not they admit to having problems or they're actually having problems such as a seizure, that's how we diagnose it. Once we find the diagnosis, it really requires a multidisciplinary team to be able to manage and take care of it. But despite our best efforts, this cancer tends to want to come back.
Yeah, is it diagnosed more now than it has been in the past?
I think partly because of the use of MRI imaging. We tend to get them much more often than we used to. So, you know, the annual incidence in the United States is about 11,000 cases per year.
Yeah, because it seems as though we, obviously because of Senator John McCain, but it seems like we're hearing so much more of late about this particular form of cancer than we did in the past.
Absolutely. Yeah, I think as clinicians, we always struggle with this diagnosis in our patients because it's so devastating to their families. And we really want to, it really requires a multidisciplinary team that allows us to provide the best care for the patient and their caregivers because, survival is limited, and we really want to emphasize helping patients live longer and better.
How is it treated?
Well, the traditional course of treatments, the first step is surgery. So to have the best surgical resection is always a good first step, plus it provides a diagnosis. After patients heal, then we use chemotherapy and radiation as our primary tools to help reduce the chances of the cancer from regrowing.
Now, from what I understand, though, like fingers, like it has tentacles. It's very difficult to treat because it does that. It spreads in that way, correct?
It does. For the surgeons, they are limited on how much surgery they can actually do. Many times they're limited because if they take too much tissue, it's going to affect the patient's function to be able to function normally. So we use radiation as a way of trying to get at those tentacles and try to reach those areas.
And what we're watching right now is your research combining what MRI scans to really pinpoint where you're going.
Yeah, so what we're trying to do at Mayo is we're using more advanced forms of medical imaging so we can actually find those tentacles, find the areas that are biologically aggressive using special medical imaging called 18F-DOPA PET scans. Then we're using advanced radiation delivery because we don't want to cause harm to the patient. So this technology called proton beam therapy allows us, almost like a smart bomb, we dial up the energy, it goes a certain distance into the brain tissue, it stops the radiation right where we want it to stop. So that way we can protect more healthy brain tissue and really reduce the risk of side effects from the treatment itself.
Interesting. And correct me if I'm wrong, but it sounds like there's a special type of sugar you put in there because what, it shows more? It makes for an easier target?
Yeah, so this 18F-DOPA is a special type of amino acid tracer that sort of mimics sugar, but what it does is it basically allows us to identify where in the MRI is the most biologically aggressive disease. So then what we're doing with proton beam therapy is targeting those areas, and by doing that, we can really provide what we're hoping is a better outcome.
There was a gentleman by the name of Mr. Casper, and apparently he was a patient that participated in a series of these studies.
Yeah.
Talk about him and how important he was to your research.
Well, I think every patient's really important, and what this patient went through and his family, I mean, he meant a lot to all of us in our department. A wonderful person, wonderful family. When he was diagnosed in his 80s with this disease, and most patients only live about 6 to 9 months. So we really emphasize quality of life as well as quantity of life. Mm-hmm. And he actually enrolled on our clinical study. And with good fortune in terms of the patient, in terms of being such a positive person. I think that goes a long way, along with what we could do as a team to help him. His survival was well over 2 years.
Wow, doubled life, that's kind of double then, right?
We did much better than we expected to, and this type of study provides hope for other patients.
It sounds as though the National Cancer Institute might be interested here as well, maybe a significant grant going on here?
So what we did is that we created a clinical trial where we enrolled patients like Mr. Casper, and the results were so promising. We're really working on expanding this to looking at a larger patient population to see that this type of treatment regimen is not only good for older patients, but it's good for all patients.
Yeah. And could it be good for different forms of cancer?
Every single cancer behaves a little bit differently. So it really requires a individualized approach in terms of trying to come up with the best plan.
Yeah, but as terms of traditional treatment for this particular form of brain cancer, this is an advancement. This is a step forward, is it not?
I think it's a step in the right direction.
Yeah.
We have a ways to go, but we're really hopeful that this can be a good treatment option for a lot of our patients.
Well, Dr. Sujay Vora, Mayo Clinic, Arizona, congratulations on your success, continued success. Thanks for sharing your story. We appreciate it.
Thank you for your time.